Recognize Mr. Garcia for 5 minutes.
Thank you, Madam Chairwoman. Thank you to our witnesses for being here today. I want to just start by noting that we know that certainly AI can be an important tool for federal government, for our federal workforce. I think we always want to make sure that we're centering those that are working in our government and uplift the work that our federal workers do every single day. But we know that AI can navigate and help government become more efficient and intuitive in many cases. I think we should be honest about that. It can also help constituents get services faster. I've seen this happen at the local level. I've seen it happen, of course, now happening at the state level and here in Congress as well. We also know that many agencies just need to move more quickly, be more efficient. And AI can be a tool when you respect the federal workforce and work with the federal workforce on how we make these implementations happen. AI can also be used, of course, on issues around red tape. I saw this happen, is seeing happening in cities across the United States. And we can analyze data better and faster. We can also work to empower our federal workforce in ways that they can use AI to help them do their jobs, and I think that's an important piece of this. It's also clear, though, that AI can be incredibly dangerous, incredibly disruptive, and certainly without guardrails can cause real harm to the American public and to the work that we're all trying to do. Now, deployment, of course, is going to take investments into work, but I do have some serious concerns about how AI is used, and it's particularly in this administration, and I want to talk about one of them, which I think is actually really, really important. So this, of course, is Robert Kennedy Jr., someone who I consider to be an extreme anti-vaxxer. I believe for him to be a conspiracy theorist and certainly has no business being the Secretary of Health and Human Services. Now, take one step back. We just went through a pandemic where 1.3 million Americans lost their lives, where businesses were shut down across the country, where healthcare was brought to the forefront of the public consciousness, and we know how important getting real medical vaccine testing information is to the American public. And right now we're dealing with measles outbreaks in Texas and other places. Information needs to be peer-reviewed, fact-checked, and done in a way that is responsible. But here, of course, we know that there was recently a Make America Healthy report that was put out by RFK Jr. and HHS. And I'm going to include in the article just this quote. There were dozens of errors, including broken links, wrong issue numbers, and missing or incorrect authors. Some studies were misstated to back up the report's conclusions, or more damningly, didn't exist at all. At least 7 of the cited sources were entirely fictitious. What we do know from many folks that have read this report is it appears that AI played a role in developing a report about the public health of Americans. This is something that we should be incredibly concerned with. And let's be clear, RFK Jr. has a long history already of dangerous, unscientific beliefs. He said 5G and Wi-Fi cause brain damage. He said that you don't believe that HIV causes AIDS. He said that water can make you transgender. These are very concerning positions. And the fact that he puts out this report, and HHS, which has been long respected as an important agency, puts out a report that is full of AI errors and AI-generated content, should concern every member of Congress on both sides of the aisle. This is incredibly devastating when you, on top of that, look at all the cuts that he's making to NIH and other health agencies across the United States. And so this is, for me, very concerning, and it should be for all of us. Professor Schneider, is it fair to say that these kind of errors in important government documents and health reports that could be due to AI are concerning to us and we should be concerned about?
I mean, they are concerning, but put the blame where it belongs. I mean, maybe the AI is not suitable for the task, or maybe the human who used the AI didn't check the work. And that would have been true if the human tasked an intern. I mean, so it's really a matter of what's the process by whatever gives you your first draft, do you look at it and make sure it's correct? We've seen the same problem with attorneys submitting briefs into courts that have fake precedents. I mean, yes, the AI made the mistake, but it's the human who puts their name to it, who says this is correct. They're the ones responsible. I mean, I teach this stuff. I tell my students to use AI, but you're responsible for plagiarism. You're responsible for the accuracy.
I agree with you completely. And sir, I also spent 10 years in the classroom teaching as well. And
it's really weird now.
and so same. And I think that the idea that we're now seeing so much AI-generated content produced in our universities is a different topic. But let me just conclude with this. I think your point is exactly right. AI can be a tool, but there has to be the human element. The workforce has to be a part of it. It has to be a responsible user of AI, and so that we don't end up with medical reports that are false. And with that, I yield back. Thank you.
Thank you. I will now recognize